Welcome to another edition of the DAMY Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. Today on the show we're talking about something I've been working on lately, which is protocols for the reduction of side effects for my cancer patients using acupuncture. Acupuncture is something that's been well studied. Obviously, it's been around for thousands and thousands of years. Naturopathic doctors in British Columbia who are trained at the Boucher Institute are able to do acupuncture in their practice. They're allowed to do 5-element theory, intramuscular stimulation or IMS, and we use it for many different purposes in the prevention of side effects and the management of side effects in integrative cancer care. It can be really, really helpful. So the 4 places I like to use it when it comes to the use of acupuncture for people who are going through chemo and radiation and surgical procedures is for pain reduction in cancer therapy, for digestion improvement in cancer, for stress reduction because it's such a stressful time, it's so intense, and for hormone balancing. So for side effects of the hormone suppression treatments, it can be quite helpful as well, and we've seen benefit for those purposes. So today, just working on building out those 4 protocols for people. I mean, the way I like to build my protocols is I like to do it on an as-needed basis. So I have all of my set protocols, and then as something gets more complicated or as I need to be more specific, I'll build those protocols out. That's kind of what I'm working on today and lately in general. We've had a lot more integrative cancer care cases come in, so my protocols are getting deeper and deeper, obviously, and having to do a little more research, which is I always like to do, and I always like to go as in-depth as possible for patients. So building out these 4 protocols: pain management, stress reduction, hormone balancing, and digestion improvement during chemo and radiation has been good. There is, this is done all across North America, but one place that seems to do a really great job at for teaching licensed acupuncturists is Memorial Sloan Kettering. They have an acupuncture in cancer program where they teach acupuncturists how to do these protocols. And I think that's just so incredible. The more specific, the more niche we can get, the better service we can provide our patients. And it's something that I might be interested in taking. I was just looking through some of the things they offer for their program. It seems that it's mostly tailored to licensed acupuncturists, so it seems like it goes over a lot of information about cancer diagnosis and conventional therapy, which wouldn't be sort of applicable for me, but knowing different acupuncture protocols is helpful. Although in this case, there is a study that came out, I think in 2011, that showed it wasn't a placebo-controlled study, so it was a study comparing acupuncture post conventional therapy versus nursing follow-ups post-conventional therapy, and it showed that on the Edmonton Symptom Assessment System, on this symptom profile score, that symptoms of side effects of conventional therapy were reduced in both cases. Statistically significant in both cases, and after 6 months, the nurse's visits was a little better than the acupuncture alone, but the acupuncture was like 16 or 20% reduction in symptom profile after only a few treatments, which was excellent. So in our practice, we have the benefit of chatting with the person during the acupuncture protocol. So one thing I want to mention about this study was that, and the way that acupuncture is usually practiced in this setting, is that there's not a specific protocol for each of these 4 types of symptom profiles we want to suppress. It's based on how the person presents. So it's usually 5-element theory. So using tongue and pulse and associated symptoms, you can build a protocol that's unique to the person. So if you're looking to do acupuncture during chemo and radiation to try to manage these side effects, or to manage the side effects of your cancer diagnosis in general, these are some of the things you want to ask. You want to ask, what type of acupuncture are you practicing? How are you coming up with the protocol? Is it the same protocol for everyone? And what's your experience with this protocol? Those are some really great questions for your practitioner. So my point in saying this is that for each of the people in the study that was done, they all had different protocols, which is really, really great. And it still was statistically significant for the reduction of symptoms on this Edmonton Symptom Assessment System scale, which is quite a common scale used in the research of therapies used for side effects of cancer, for cancer symptoms in general. So pain, fatigue, stress, digestion, hormones, those type of things. So really, really, really cool. I love acupuncture in general. Of course, we do a lot of it here. I do a lot of IMS in my practice just because I see a lot of physical medicine patients, and but I find it incredibly rewarding to be able to help someone along their journey with the conventional system and make it as easy as possible. And acupuncture does that. And the benefit of these visits with a naturopath is you get to chat with them and you get to talk about the holistic approach while you're doing the acupuncture. Like, what kind of things can we tweak dietarily? What kind of supplement dosing or choices can we tweak while we go along this process? And that provides a huge benefit as well, because it's like 30-45 minutes of just chatting, checking in, trying different stress reduction techniques. Like, sometimes with my patients, I'll have them lying doing acupuncture and then doing the Muse meditation headband while they do it. So doing a neurofeedback meditation while they're doing acupuncture. So the cool thing about Muse is that it's neurofeedback. When you're doing the meditation, if you're in a state of calm, you hear birds chirping through the iPhone app. If you are in a state of racing mind, stress, anxiety, inability to center yourself, then you hear loud weather patterns. This is the meditation that I use for these people. So it's a really cool thing that we can do while doing acupuncture. And then, of course, we can talk about the journey and try to mitigate side effects in other ways. That's kind of my thought process around symptom management when we need frequent follow-ups and we're not doing an advanced therapy like IV vitamin C or anything like this. It's really nice to have something like acupuncture, and the good thing is there's really good research for it. So I really, really like it. And when big cancer centers jump on board like Memorial Sloan Kettering, then I like that even more, because it brings that extra validity. It brings that extra side of things where, oh, did you see this program that they're doing? You know, they have acupuncturists in their cancer center. And fortunately, you know, we can provide this service here in Canada through your naturopathic doctor. So I love to see that. That's all I wanted to touch on today, just building out these protocols. If you're dealing with a cancer diagnosis, if you're going through chemo and radiation and you're suffering with poor digestion, significant stress, you know, you're having hot flashes or night sweats, or you're having significant symptoms of hormone imbalance, or you're doing some purposeful hormone suppression, which can be really helpful long term, but it's uncomfortable, or if you're having significant pain of therapy or cancer pain, consider acupuncture. It's a really good one. It's really easy to do, and there are so many good people around. You can easily find someone who can help you out. You can probably find someone this afternoon. Thank you so much for watching. That's our show for today. I'm just going to keep updating you on what's new in our practice and what we're doing and what I'm interested in and what's sparking my interest, and just trying to generate a conversation on integrative and complementary medicine to try to get as many people on board as possible, because we see so much value in this medicine. Thank you so much for watching. Hope you have a great day. We'll see you tomorrow.